Hello, vision therapy friends. This is Tom Headline, and this is the second in our series of videos related to our vision therapy products. A few weeks ago on the VTOD Facebook group, there was a question about what tumbling E charts or flipped E charts are. And this is an example of one. I don't make this chart. This is from many, many years ago. But what's nice with the flipped E chart is the patient would be able to point their hand whichever direction the E is pointing. So if they don't know their directions of up, down, right, or left, they could demonstrate it for you. So you could work with people who may not have language accessible to them, or with small children who may not know right, left, up, and down, and they could just try to point their hand which way the E is indicating. So several years ago, I made a product which is a flipped E chart that works with red green glasses. What's nice with this is when the patient wears red green glasses, certain characters are presented to one eye and the other characters are presented to the other eye. So the patient could be monitoring their binocularity while they're also performing the chart. Another nice thing with a chart such as a flipped E chart is you could use it in 4 different directions. So you're essentially getting 4 different charts out of one chart. If the patient found maintaining both eyes being on simultaneously difficult, you could do a technique where you would have them wear red clear glasses, and you could put the clear lens over the eye that's tending to suppress them most. So that way, when they have the red filter on, the eye under the red filter will only see certain characters. So if they did suppress the eye that had no filter on it, they would know because some of the boxes will not be seen. Now, what's nice with the flipped E chart is that you can incorporate concepts like laterality and directionality into your training. So you could have the patient pointing which way the arrows are facing, or the flipped E's are facing, or you could also have them name the direction. You could have them say up, down, left, and right for whichever way the E is facing. Some other nice training that you can do is you could use a balance board. And so with the balance board, they could tilt the board up, down, right, or left, corresponding to the direction of the E. I also like to do a technique where I will take a jump rope, or you could take tape, and you could make a box that the patient stands in the center of. And then what they'll do is jump forward, back, right, or left, depending upon which way the E is facing. I usually like to have them jump in the direction, then back to the center of the box, and then jump the new direction and back to the center. So you can incorporate things like that. Now, another nice thing about using an anti-suppression chart is you could have the patient also use an accommodative flipper or a prism flipper and see if the patient's able to make a change of accommodation while staying binocular. Or can they make a change of vergence with the prism flipper and still stay binocular? So you do have many options available to you using the flipped E chart. So I hope you check them out on the link provided above. And if you have any questions, feel free to let us know at www.headlinevisionenterprises.com. Hope you're having a great day, and we'll talk to you soon. Bye-bye.